if you haven't already heard of the STARS program, you're going to learn from an expert. She's been with the program 20 years. Reginia Guess, welcome to the program.
Thank you very much. My pleasure.
Now, there are counselors, I realize, at high schools.
Right.
This is not the same kind of setup. What makes your program different, and who are you trying to reach at the school?
Yeah, that's right. We are a little bit different. What we do is we try to address issues that deal with social and emotional barriers to learning. So we're not about necessarily the schedules, or I want them to have great GPAs, but we're looking at other issues that impact them in the school itself. We're in 6 Middle Tennessee counties. We provide education, counseling, early intervention, and we connect our families and students and their families to local resources as well.
Okay, full circle.
Yes.
What are some of the prevalent issues that you're seeing in the student population? Are we specifically looking at substance abuse issues or other things?
Well, other things, and whatever they present with. Right now, there are a lot of mental health issues that are going on right now, dealing with anxiety, trying to self-regulate emotions. Of course, substance use is always a constant. That's in any school, in any county, in any district. Just pure connectedness and school connectedness. So it's just a wide range of things that we address. Whatever the student presents with, that's where we go. That it's an emotional or social barrier to learning in the school.
To learning. Okay, obviously if you're having mental health issues or substance issues, that is definitely a barrier to learning. Are you seeing more of that? Because you have the history of being there 20 years. You're at Franklin High School.
I'm at Franklin High School,
in
yes.
Williamson County.
Right.
So have you seen the issues with mental health, the problems
I have seen
growing?
It skyrocket.
Why? Why do you think that is? Is it access to social media where you, and the peer pressure, all of that ties together? I know we talked a little bit about that in a previous program. Is that all interconnected?
I think so, but I also think it's just the times that we're dealing with right now. There's just so much going on with our kids, and parents are very active. You know, they're employed. They don't have as much time to spend with their kids. It's just coming from a lot of different directions. Social skills, maybe some things just are not diagnosed, or now they are being diagnosed better.
So you maybe would connect a student that you identify as having a mental health issue with a healthcare provider, or at least contact the parents and get that in motion to help the student. You connect
if needed,
the people
but
if
also just helping that student be able to be in the school and go throughout their day, you know, giving them skills, coping skills, and interventions that will help them to academically still be okay in the school.
If they don't come to you and knock on your door, Ms. Guess, I'm having an issue, because let's face it, a lot of kids are not going to do that.
And some do.
Some do, though.
Some do, but also there's another way that they can come to see me. We have an internal referral system where the staff, administrators, the entire school is educated at the beginning of the year of how they can make referrals, what to look for in kids. They come that way. Sometimes I just get parents that call me and say, I'm concerned about my child. Would you mind talking to them and finding out what's going on with them? And so, you know, have to go that way as well and assess what's going on.
If they're not receptive to you, what is the next step when they're not receptive?
When they're not receptive, and if it's a minor thing, sometimes we just get the teen angst, you know, that kind of thing. The next step would probably be a telephone call to their parents and just letting them know the services were offered and that they declined. But most of the time, they are pretty receptive. We're in the school. They see us. They know us. You get less resistance.
Because of the familiarity.
Exactly.
They see you around. Okay. When you identify a student who's having some issues, so what are the steps that you follow to deal with that particular behavior?
Well, when I identify that a student has a problem, I try to find out, you know, just what's really going on. You have to build a rapport and everything, and I just forgot what I was going to say.
No,
I hope we don't start all the way over.
No, that's okay. Let's go on to the next question.
Okay.
How successful has the program been so far? Because I know you have good outcomes.
We have good outcomes. We're seeing increase with academics. We're seeing increase with school connectedness, less tardies, less absences. just more connectedness to school extracurricular activities.
Wow.
So we're seeing a lot of different things, a lot of different successes that way. We're seeing students that were on the potential of failure for graduation, you know.
And you can intervene and
you can
make a
intervene
difference.
and help with that, yes.
Do you work with the other counselors at
Yes,
school?
yes.
How does that relationship work? Where
It's a very collaborative relationship. I
That's
just had a
great.
situation this morning where I was working with a counselor, and so we're back and forth with that. Sometimes they will make referrals as well. Oftentimes at my school in particular, they will introduce a student to me as another support in the school so that the student knows these are other places you can go as well.
So there's follow-up. That's, I would think, would be an
follow-up.
important piece
Absolutely.
of all of this. Now, I know that you also have a way of students or parents, if someone's watching
Right.
and they want to know, okay, how do I connect with her?
Okay.
Is there some kind of phone number or website?
You can call any Middle Tennessee high school, middle school, ask for the STARS specialist or STARS counselor, whichever you prefer, and you can contact us. We're also located on the website starsnashville.org.
STARSNashville.org. Okay. Is there a helpline as well?
Well,
or-
we don't have a helpline connected to ours, but you
yours.
know, I mean, drug-free partnership for drug-free kids. That's a nice website as well. You can call Oasis Center. I don't have their phone. I think it's 327-4455.
Okay.
But the simplest way is just to make contact with us at the schools.
And you want to just say, don't be intimidated
Not
to
at
come
all.
in.
I get
come
parents
in.
that you can come in, you can call. I get parents all the time that kind of want coaching, how to talk to other parents who you feel like may also be having the same problem and that kind of thing.
All right. Okay. Thank you so much,
You're
Reginia. Great to
welcome.
meet you.
Nice to meet you as
Thank
well.
you. And we'll be right back with more after this. Thank you for watching Community Health Matters. Learn more ways to improve your health at mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.